Welcome to Smart DS Media. Before I start, I will employ us to subscribe, hit the notification bell and share. Today we will be sharing with us the topic public health. But many people will be wondering, what is public health? Let's learn public health. Let's talk about public health. Public health have made significant impact on the health of the population, making people healthy and saving lives. For example, in the United States, between the year 1900 and to 1999, people's life expectancy have increased over 30 years. Do you know that the 25 additional years is due to public health interventions? In this video, we are going to take a look at what public health is and how it's different from clinical medicine, who is responsible for doing it, and how it's done. First of all, let's have a look at what health is. The World Health Organization defines health as a state of complete physical, mental, and social well-being, rather than a mere absence of diseases or infirmity. This is a pretty bold and ambitious definition, allowing people to look beyond diseases and focus not only on the physical aspect of health, but also on the mental and social aspect as well. And public health, well, public health is the science and art of preventing disease, prolonging life, and promoting health through the organized effort of the society. Okay, so how is it different from the clinical medicine? Let's take a look at an example. Let's say someone had an accident with a broken leg. A clinician's main focus is the immediate health problem, fixing the fractured leg. Clinicians focus on the individual. The public health approach will be holistic and will focus on figuring out how and why this person had an accident, so that actions can be taken to prevent it from happening again. That is reoccurrence, to prevent reoccurrence. For example, why did it have the accident? Was there a problem with his vision? Was it poor knowledge of driving skills, or poor attitude towards driving? Was it under the influence of alcohol? Or was he on drugs when he was driving? Are there laws against it or resources to enforce it? What are the community expectation or attitude towards driving? What are the community expectation or attitude towards driving? Does it have a good social network that will help in this recovery or prevent it from happening again? Was the road he was driving on unsafe? Was he driving a safe car that was well maintained? If not, why not? Could he afford it? If not, why not? Could he not afford it? If not, why could he not afford it? Does he have a job? Does he have a job that doesn't pay well? Why is that? Is it because he doesn't have access to good education? Was it access to good health services which will determine his treatment and recovery? As you can see from this example, health is determined by a complex interaction between many factors determinant of health. These include individual characteristics, lifestyle and behavior, and also the physical, social, and economic environment. The social determinant of health. In order to make a difference in health, there is action needed across all the different determinants. Public health focus on these upstream factors to make changes that can benefit the health of the population as a whole. This seems as a broad and complex task. So who is responsible for public health? Ultimately, the responsibility of creating a healthy community rests with all sectors of society. Health departments do have a central role in public health. However, improving the health of the population require the cooperation of coordinated effort of a broad different stakeholders. These include other areas of government, the private sectors, non-governmental organizations, international organizations, and communities, to name a few, all united with a single goal of improving the health of the society or community. Now we are going to look at how public health does work. The World Federation of Public Health Association has developed a useful framework to understand how public health is delivered. There are three core service areas of public health and a group of enablers to ensure this service can occur effectively and efficiently. The three core areas of public health are protection, promotion, and prevention. Protection is about protecting the health of the population. This includes the control of infectious diseases, managing environmental hazards, ensuring the healthy workplaces, and managing health emergencies. Promotion is about improving the health of the population. It covers a broad range of activities, not only focusing on the health of the individual, like promoting the health behavior of a life course. It also focuses on improving the social determinants of health. While prevention is by preventing health issues before they occur. It includes activities such as vaccination and screening. There is need for good governance, advocacy to influence and support for commitment for action, having an adequate, well-trained public health workers, and having accurate, timely information to support health actions, such as relevant research, having accurate, timely information to support health actions, such as relevant research, surveillance, monitoring, and evaluation. That is a quick introduction to a fascinating field of public health. You have had to look at what it is and how it's different from clinical medicine, who is responsible for doing it and how it's done. Please kindly subscribe, share, and hit the notification bell. Thank you.